Clinic to Community is a program for individuals of all ages living with a diagnosis of epilepsy. Epilepsy is the medical term that is given to a person who has had 2 unprovoked seizures or 1 seizure with a strong possibility that they will have another. The Clinic to Community program is offered in partnership with your healthcare provider. Because together, we are able to offer coordinated care for you and your family. The program begins with an individualized meeting with a trained epilepsy educator who will help you to understand your epilepsy diagnosis. The educator will meet with you and your family at the clinic or in your community. Over the course of an hour, you will learn about your type of seizure. You will learn proper first aid to stay safe during a seizure and when it is a medical emergency. You will also be provided with information about how epilepsy is diagnosed and treated with medication, special diets, and surgery. In the Clinic to Community program, there are tools to help you manage your seizures. One tool is a seizure log. A seizure log is used to document what happens before, during, and after your seizure. This information is important for making the best use of your healthcare appointments and can also help identify potential triggers associated with your seizures. In the Clinic to Community program, you have access to more than 35 information sheets. They are filled with strategies to help you and your family best manage and cope with this condition. For students, the program components include school safety plans and materials for teachers. For employees, there are resources outlining your legal rights in the workplace. There are also materials to ease the stress of talking to your employer and coworkers about epilepsy and seizure first aid. Women with epilepsy will learn relevant information related to birth control, pregnancy, breastfeeding, and menopause. You will understand the link between epilepsy and ADHD, learning disabilities, depression, anxiety, and memory. For management of seizures and promotion of quality of life, there is information about seizure triggers, healthy lifestyles, and the importance of staying physically active. Find helpful tips on how to access life insurance and seizure dogs, sleeping at night, and staying safe in water. There is a series of brochures about SUDEP targeted to parents, teens, adults, and healthcare providers. There are fact sheets with details about driving eligibility and license reinstatement, government disability programs, and drug benefits. Our trained Clinic to Community educators will provide you with individualized support because it is often tough to deal with the unpredictability and fear of having seizures. All program components were developed to align with the recommendation in the Ontario Guidelines for the Management of Epilepsy in Adults and Children. They were developed to provide you with access to the right information at the right time. Most importantly, the program recognizes that each person with a diagnosis of epilepsy is unique and has different needs for information and support. If you would like more information, go to www.clinictocommunity.ca or email us at info@clinictocommunity.ca. We would like to thank the Ontario Brain Institute, EPLink program, and the Ontario Trillium Foundation for their generous support of this program.